I guess I can take this off for a moment. Good evening, everybody, and welcome to our event, and welcome to everybody who is online. I hear that we have a tremendous number of people who are joining us virtually, as well as those of us who are assembled here. I want to welcome you to this event, A People-First Approach, Improving Government Customer Experience Through Technology. I want to thank the Georgetown Tech Policy Initiative for co-sponsoring today's event and for their commitment to promoting discussion, debate, and analysis of the intersection of technology and public policy. In December, President Biden signed a new executive order directing federal agencies to put people at the center of everything the government does. That doesn't sound like such a surprising thing, right? People at the center of everything that government does. But it was an important innovation. And research and engagement from the McCourt School experts, including Pam Hurd, Tara Mcginnis, Don Moynihan, helped inform the executive order and put in motion a sweeping plan to transform the federal consumer experience, increase accessibility, and reduce administrative burdens. These burdens, the bureaucracy, sometimes confusing paperwork and red tape that Americans often encounter in their interactions with government, affect whether people get access to public services and can reinforce inequality. It can also shape people's sense of the potential for democratic institutions to support our quality of life, the potential for effective collective action, which you heard me say many times is at the center of what we do here at the McCourt School. You may have noticed that a number of customer experience improvements have already been implemented from the Biden administration's long-awaited website to sign up for free COVID-19 tests, to the House of Representatives' efforts to modernize legislative operations by launching a digital services team. In all of this, Pam Hurd and Don Moynihan have done extensive work on public sector performance and administrative burdens that have contributed to our understanding of these problems. And their book is considered one of the foremost resources exploring those burdens that exist in government, and they continue to contribute to growing scholarship on that subject. And Tara Dawson Mcginnis, excuse me, Tara, we were talking about one last name or two earlier today. Tara's research on public interest technology has helped open up a discussion and a re-examination of the challenges and the opportunities of using technology to reduce burdens and modernize government programs. These and other McCourt experts have been instrumental in discussion around the importance of improving services to the public. So Pam, Tara, and Don exemplify what it means to be a change maker, a term we use here a lot, and we celebrate their role in shaping policy that will help further democratize critical programs and services. So in that context, I am very pleased to share this event with you, and also to share that following the event, both of the books that Tara and that Don and Pam have written will be available and will be available for signing. I will tell you that I have signed copies of each of them. I want to thank today's organizers and attendees for your engagement on all of these topics. And now it is my pleasure to introduce Gustavo Murillo Velasquez, another person with two last names that we were talking about earlier, a Master of Public Policy candidate at the McCourt School, and the event lead for the Georgetown Tech Policy Initiatives, who will introduce our panel.
Thank you, Dean Canchon. It is my honor to introduce each of our experts panelists. Barry Bacon Jr. is a columnist at the Washington Post, covering the Biden administration, local and state politics, and race and identity. Before joining the Post in May 2021, Barry was a government and elections writer for Time Magazine, the Post National Desk, The Grill, and 538. Barry will moderate today's discussion and the audience Q&A. Amira Boland is a federal customer experience lead in the Office of Management and Budget. She helped write the Biden administration's executive order on transforming federal customer experience, and she's actively working across federal agencies to implement policies that make government programs and services work smarter. Pam Hare is a professor and researcher at the McCourt School, whose work focuses on inequality and how it intersects with health, aging, and policy. She's a leading expert on administrative burdens and co-author of Administrative Burden, Policymaking by Other Means, which has received numerous awards. Dawson Mcginnis is an adjunct professor at the McCourt School and the founder and director of the New Practice Lab at New America, which focuses on improving government's delivery for vulnerable families. She is the co-author of Power to the Public, The Promise of Public Interest Technology, which former President Barack Obama called worth a read for anyone who cares about making change happen. Don Moynihan is the inaugural McCourt Chair and Professor at the McCourt School, whose research seeks to improve how government works. He's also a leading expert on administrative burdens and co-author of Administrative Burden, Policymaking by Other Means. Please join me in welcoming our panel.
Okay, so let's get started. I guess what I'll probably do, just for the audience, Pam and Dan are, we'll call them research experts in the field. We'll call Tara kind of a player coach. She's like teaching about this, but also has done a lot of work in it. She worked in the Obama administration, and then Amira is like doing the work too right now. I think that's a good way to help people kind of know where speakers are coming from, what they're going to talk about. So what I'll do is I have 6 sort of main questions I want to ask, and what I'll do is I'll sort of call out one person to take the question, and then hopefully, the other person, one other person hopefully will respond, and then if you're the 4th person, make sure you have something really to say, or just let's move to the next question. If we don't want to have, poor repeating answers. So, with that, I guess I read an article in prepping for this, and by Jason DeParle of the New York Times. So I'll assume it was probably correct. And what it said was about 82% of people eligible for food stamps get food stamps. About 78% of people eligible for the Earned Income Tax Credit get that. About 24% of people who are eligible for cash welfare payments, direct cash, get that. So I'll start with Pam. Can you talk about how do we get, why are those numbers not 100, and then why is one number 82 and one number is 24? Like, how does it end up happening where we have some programs that are not used and no program is near 90 even?
Yeah, it's a great question. So in terms of why these programs aren't at 100% altogether, is a part of what we talk about, the sort of burdens and barriers that people face when they're trying to access government services or benefits. So it's the complicated forms, it's figuring out that you actually might be eligible for a program and knowing to apply. And it's about meeting the criteria, the kinds of documentation you need to provide to actually become eligible for those benefits. And so that's a real pattern in any kind of benefit basically that is targeted, like food stamps and the Earned Income Tax Credit. It's just not unusual to see a certain amount of burden built into that program for beneficiaries. To point out the contrast, though, just because I always like to remind people of this, when we ask people to apply for a program like SNAP or food stamps, they have to show up at an office typically, do an interview, they'll have to provide, say, earnings, oftentimes at least they'll have to provide evidence of their earnings. And that's why we see this play out into a lower take-up. But a program like Social Security, for example, the retirement part of the program, the government keeps track of your earnings for you. And there are literally thousands of field offices around the country that can help you enroll. You can enroll online. So it's not that there's necessarily more burden in SNAP or food stamps than there is in, say, the Social Security retirement program. It's just the government has kind of taken the burden off of our shoulders in the Social Security program more than they have for SNAP or Earned Income Tax Credit. And then very quickly here, I'll just sort of finish up. The difference why TANF, temporary aid to needy families, cash assistance has like a take-up rate of 25%. A lot of it really has to do with the fact that programmatic design, and particularly SNAP and the Earned Income Tax Credit, are federal programs. They're controlled by the government, by the federal government. The federal government sets a lot of standards and rules about how states actually implement them, which inevitably makes it a little bit easier than for a program like cash assistance for the poor or TANF, where those states just get like a block grant and they have enormous flexibility in how they distribute those funds. And you can describe this across so many different programs. Federally controlled programs do tend to have much, much less burden than programs that have sort of heavily devolved to the states.
You want to add anything to add there?
I'm happy to jump in with a bit of what it feels like on the other side of it. There's a story that we tell in the book about the longest form in the country for public benefits, which includes both SNAP and TANF in the state of Michigan. It was 42 pages long. It was 1,800 characters. It took the average person somewhere between 2 and 8 hours. And it was described by one woman who we talk about as living hell. That her house had just burnt down in a fire. This was the welcome mat to assistance, and it asks lots of questions like, how many fathers do your children have? Humiliating questions. And it was the front door to all of these assistance programs for over 1 million people in Michigan. A team at a place called Sevilla seized on this form. Someone who used to work for the United Way saw it, and he took it and he taped it end to end, and it would have stretched all the way back to the back of this room. And he just was like, this is not what help can look like. And he basically went on a mission to research what it was like for people using the form and what it was like for frontline state workers who were trying to adjudicate the form. And they collected data and stories, and they found that actually there was kind of no mathematical science to who got through and who didn't. And they did a very bold thing. So they asked for a briefing with state officials, 4 senior officials who oversaw this form. And instead of bringing a memo or a deck, they brought them into a room that they reconstructed like a public benefits office. And they played background noise, and they didn't have enough chairs, they didn't have enough pencils. And they said, welcome to the Tech Town Public Benefits Office. We'd like you to fill out this form. And they sat in 11 minutes of awkward silence with these senior officials. And then they walked them through the research they had done about the time it took. And before the meeting had ended, these 4 senior officials committed to change this form, which now has been cut in half and has a dramatic reduction in the mistakes that are made. So it is possible, but I think it is only when we can see what the experience is and what and took agency, took almost a year and a bunch of legal counsel to change it, but it isn't like inevitable that this administrative burden has to be the way it is.
2 short follow-ups. So if we found the 18% of people who didn't get food stamps, what would be the sort of story that explained why? And the second, if I interviewed the 41-page people, why would they be apologetic, it sounds like, but would they know why the form ended up being 41 pages?
So I'll take the last first and jump in if anyone else wants to talk about it. I think first, several of those senior officials had never seen the form.
Oh, okay. Wow.
And in theory, it was long because they tried to make one form for all the benefits. Mm-hmm. And there are instances, back to Pam's comments about kind of state engagement, where the form is long by design. There are many unemployment insurance forms, for example, in Florida, that had a form you filled out before you got to the form to keep people from getting benefits. But often, and I think more often than not, someone added a question in 1978, and some other agency added a question, and no one who's in charge, it's like, my students at Georgetown, I make them look at forms all the time, but very often you can be an expert in the field and never have seen your front door mat to the public. It's just not how we train ourselves. So it isn't necessarily by design, it's often by kind of default that something gets this complex.
One of the things that we actually have in the executive order is a commitment by the Social Security Administration to go through all of the times, and this is a process mapping exercise that no one centrally has ever done, like from one vantage point, right? Like you talked about, there at the Census Bureau, there's offices that own questions, and so people are set up around, like even our organizational design is set up with like different sections of a form, and so one of the things we ask them to do is to literally go through. Anytime they asked for a wet ink signature, original documentation, or an in-person visit, and then literally with columns say, is it because this is just the way we do it? Is it because it's in a rule or a reg? Or is it because it's in statute? Okay. And most people, and that's like so wonky to do that like weedy exercise of like, do we legally have to ask for a wet signature? Or do we just like think that was a good idea? Because when we created the process in, 1940, we needed a wet signature. And So that's been really interesting to even just watch the like central mapping of why it's like that.
18%. Sorry, finish. Well, go ahead. Go ahead.
Oh yeah.
Well, so to Tara's point, I think one thing we found in talking to public officials is that people who have direct experience of, say, the welfare system are much less tolerant of administrative burden. So we did one experiment where we tried to map this out, and one thing we controlled for is, have you been on welfare before? And most public officials, most elected officials haven't.
That's surprising. Yeah.
But those who had were much less supportive of imposing new burdens on people. And so part of the challenge here is putting the public at the center of the design of these systems and forcing, often middle class, highly educated people who don't have direct interaction with these systems to put themselves in the shoes of the people that do, in a way that Amira describes as one device to force them to do that.
And to your 18% question, one of the biggest explanations is the in-person interview requirement for the Supplemental Nutrition Assistance Program, right? Because you're looking at people on relatively low incomes working in really inflexible jobs, right? So you might not know your work schedule for Tuesday on Monday, or you might only learn it on Monday. And so there's really robust evidence, especially in California, where they have county level variation about this. It pretty much demonstrates that in-person interview is a huge obstacle and explains a reasonable amount of the lack of take-up. Kind of correlated with that, and this is a problem in other programs, including Medicaid, is the recertification. So it's not like the process doesn't end once you get on the program. You have to keep demonstrating that you're eligible for the program. And we see it's called churn, and you see a lot of people flow off the program, even though they're still eligible, because they made a mistake in the process of trying to recertify, or they missed an interview, or things like that.
Dan, I read about so I guess that my mom is Medicare age, this is not unusual. And Medicare is this very popular program. That's why all the candidates say Medicare for all. That's partly why they say it. It doesn't seem to me that Medicare is actually that easy to use either. Can you talk about Medicare and both why is it popular, but why is it also not that easy to use?
We do, and this gets to Pam's point. There are burdens in just getting on the program, but actually using benefits will often impose their own sorts of burdens. And so, especially if you're an older adult, Medicare requires that every year you have to sort of pull out these endless numbers of options. You have to sort of think about which insurance package is right for me. The one you had last year might have changed. Your health status might have changed. There's one study found that about 95% of people do not select the most optimal insurance program for them. They sort of stick with the default over time, even if that's not the best for their particular healthcare needs. And that's, in Medicare, we sort of think intuitively giving people more choice helps them. Like it's like a marketplace, and so if we give you, not just 2 types of jams to choose from, but we give you 80 types of jams, you're going to be better off. And the reality is, for most people, that's overwhelming, and it's not really helping them to choose the right options.
There's so many different examples of that too. Like Part D is incredibly confusing,
That's
right? That's your prescription drugs, yeah. And Medicare has gotten really good now about building in. Now, I think for the first time last year, a year and a half ago, they actually allowed you to be able to pull your prescription data so that then you could see which plans covered the prescriptions that you were on to help inform your choice. But even when you look at GI benefits, for example, at VB, at the Veterans Benefits Administration, when you look for institutions that accept the GI benefit, they were listing them, I think they still do list them alphabetically. And so all these private institutions know you need to have a lot of A's up front in the title of your institution so that because people are not going to click through to the next page, right? And so, there's so many points at which we're presenting people with a lot of choices, and as the federal government, we think we have to give you all of the information. And there's so many examples of even when we were working with federal student aid, this was our behavioral sciences team, they were trying to get people to enroll or to apply for their FAFSA, their federal student aid, And they wanted to send, typical like government agency, we want to give them all of the information, like go find your institution and then figure out what your major is and then figure out how much that costs. And then it's like, no. Right now, all we want people to do is fill out the FAFSA form. Like then they can find out how much aid they get and then they can think about where to go. But like we overload with information and make it really difficult to make good choices.
Medicare is popular because, I think it's worth asking, like, because a lot of programs are going to come to are not popular. So.
Yeah, right. Medicare is a profoundly popular program, right? Medicare and Social Security are kind of the golden goose eggs of our social welfare system. And it's popular because it's universal. It's popular because, in fact, in the end, the coverage can be better than what a lot of people have experienced prior to eligibility. But I would say I think it's important to note that kind of this chaos when you enroll in Medicare has gotten worse over time. It's always been a little bit complicated because the federal Medicare benefit doesn't actually cover all of people's healthcare costs. And so people top up with a little bit of private insurance. And it's the private sector part that makes the program confusing. But what we've done over the years is kind of expand private sector health insurance involvement in the Medicare program. And as that expansion kept going, it kept getting more confusing. And I mean, we can argue about whether that's deliberate or not. It's profitable for insurers to make it confusing, right? But that's part of what's gone on. But it is still popular. I do worry a little bit, though, over time if this will, to some extent, undermine the popularity of the program, because it can be really frustrating for older adults on an annual basis, constantly trying. I'm sure you saw with your mom, I see it with my mom, trying to navigate those benefits every year.
Next question is for Tara, and this is kind of why I'm here, is I was working on a project. Tara was, when she was working for the Obama administration, I was working on the Obamacare implementation, and I was working on a project where I would fly around the country and go to enrollment events and so on, and often I would learn about this form. This program is not working perfectly, and people are finding this form confusing, or they're not eligible, and sometimes the Republican governor was trying to make that the case as well. So Obamacare, talk about what kind of worked in the sense of implementation, what really didn't work, and if you designed it tomorrow, what's the sort of 2 or 3 things you would obviously change?
So, in some ways, it's taken to where we are many open enrollment seasons in for it to be what would have been ideal open enrollment one. So, what the form is today, what your lived experience is, how your choices are presented is profoundly better today. For me, it was a crucible for my experience of working on policy and advocacy for decades and really thinking, we passed this massive piece of legislation. I went in on a very weird role, which was a role that was created. I think I may be the only person who ever had to interview with the Domestic Policy Council, the Office of Health Affairs, the Office of Public Engagement, and the Communications team, that they profoundly understood from the get-go that the policy idea was connected to people's ability to access it, but the assessment of what would be the barriers were incorrect. My job was to use data in a way that was different to reach hard to reach people. That only worked if you had a functioning website. So the assessment of what would be the administrative burden barrier. What did work and what has grown from the catastrophic failure to, I think, catastrophic success of Obamacare is the muscle inside the federal government that sees delivery as important. So born out of this crisis was a new government agency, the U.S. Digital Services, which had designers and product managers and project managers and data scientists and engineers, and drew talent, product-type talent, to the idea of public service in a way that I think is semi-unprecedented in the United States. And what came of that was constructing really mindfully, working with consumers to understand what were the confusing words, really pushing the policy team to say, I know you'd like to collect this data, but back to Amira's question, we can't make a 4-page form with this type of specs. So if you'd like all of these pieces of information, some of it was in fact a policy challenge that creates a product delivery challenge. With, we order up what we'd like to know, but in the end that creates a very long form or really long engagement process. Finally, the the unintended experiment, I see Judy in the front row, of having a bunch of states drive this themselves really did lead to a bunch of great practices that now have expanded. So I think in some ways it was a clarion call for people with a new set of skills to come into the government. And it's a model that incredibly well thought, hard fought policy is only as good as its ability to be delivered to the final person. And we came within a hair. I don't think it is inevitable that it would have course corrected to build a website. There was a window in which you could have fixed this. And so like for policy students, for folks in the world who think deeply about like, I'm going to create the next climate policy, it is really, or tax, whatever it is you care about, it is really only as good as your ability to think it through to the final user.
I think just on that, like it took that size of a crisis in the federal government for that muscle to emerge, for that capacity to be developed in government. Whereas earlier you talked about TANF, where over the years it's just become less and less accessible, and there hasn't been an equivalent response to say, why is this program not working? Why is it not reaching people? And so, this is one of the great unintended or unexpected consequences of the Obamacare rollout is the creation of the U.S. Digital Service, all this talent coming into government.
Explain the U.S. Digital Service in 1 minute for people who maybe don't know what that is.
Amira should explain the U.S. Digital Service.
Finish your point, and then we'll finish with this, and then somebody explain it.
But brought in folks with a different background, with certain skill sets to think about the role of technology and policy implementation that just wasn't there in the federal government. And I think absent that problem would not have occurred within the federal government. Whereas we will still see, for example, the Internal Revenue Service running these very outdated technological systems, clearly absent the capacity they need to implement many welfare programs that we're asking them to implement at the moment. So the point is there's sort of a mismatch between our capacity to do really good delivery of public services and what we actually aspire to do. And I think the U.S. Digital Service has helped, but I think that it's helped, but they're facing a much broader problem. So I'll hand back to you guys.
Yeah, the U.S. Digital Service is an amazing team. It's about 150-ish people that they formally kind of sit within the Office of Management and Budget, but very much operate as this really cool new type of government agency, right? As Tara said, they recruit in, they have designers, product managers, engineers, data folks, and they have appreciated what it takes to actually recruit good talent. So they actually have an incredible talent team as well that's constantly getting folks excited about.
So these are people who work at Google but want to get paid less, basically?
Exactly, yeah. They've made a lot of money at Google and want to do something different now, yeah. And so it's great because they are, sometimes have been lovingly called like the firefighters because they often will take on projects that it's like a crisis, right? And so we need a team quickly to go in, diagnose what's going on, figure out how to pull together the contract that agency has or the IT system that they have or the legacy system that they're trying to fix. And then they can also, as Tara said, like we've built this amazing muscle now. So when you have a vaccines.gov or a COVID testing.gov that needs to get quickly rolled out, they can help and already exist to help work with the agency to actually do that product.
Next question is for you. So the last two administrations did in this coronavirus period did direct payments to people and did the PPP program for businesses, I guess. And then the Biden team has done these the child tax credits. So talk about those three programs, what has kind of worked in terms of reaching people and maybe what has not worked in terms of reaching people.
I think one of the things that's actually quite impressive is that the quick ability of the Bureau of Fiscal Service to work with IRS, to work with SSA, to work with Medicaid, to identify folks proactively, right? Like to Pam's point around sometimes when the federal government can run a program, they can do a lot of the burden work, right? Like those payments went out automatically to most people. And that was a huge data matching exercise. And so I think that worked really well. Obviously, there were still lots of people that were eligible for those that did not get them, and then it was a huge effort to try and connect those folks with more people with the payments. But I think that was a really good lesson learned of agencies being able to work together fast. And some of the mechanics of like the federal government working really well, being able to issue checks, like that, it sounds like a basic thing, but that's actually a really hard thing to send checks or make direct deposits to a lot of people overnight. So it worked well. I mean, there were definitely lessons learned from that worked well.
Anybody else want to add? I'm a journalist, so I want some negative too. So
Oh, yeah,
please.
sure, yeah.
But
I'm happy to talk about the component that was the most difficult, I think, which is the federal government is really good if we have your bank account and we know where to find you. And we pay you for veterans benefits and we pay you for, if you are, what I would argue is among the most vulnerable, you don't make enough money to have to pay federal taxes.
Oh, I see.
This is the 20% who don't get the EITC. This is the people who I'd argue needed the stimulus check the most. And to be frank, early on in the last administration, no, I don't think like people had thought through, oh, there's a bunch of people we don't have are. And so, making clear, wow, this is a pretty big number of people who need the check most, but fundamentally, non-filers or infrequent tax filers, we have really moved more and more of our poverty programs to the IRS, which is super good at helping taxpayers, and has yet to really, I think, now in the kind of affirmative story of progress is that the child tax in service of the stimulus check, after that gap of I don't make enough money, I'm not getting my stimulus check was identified, then there was like a website set up that allowed people to self-identify that broke the barrier, something the IRS said they could never do in other years. And then when there was like pressure that a subset of people were not getting them, they basically set up a website that on the back end said that person's a taxpayer, just send them a stimulus check. It was kind of, they did, and that built in some ways a lily pad from which the child tax credit grew. The child tax credit has the same conundrum as the earned income tax credit, as stimulus checks do, of reaching the people who don't make enough money to already be easy to reach. And so the child tax credit has actually grown the number, or reduced the number of people who are non-filers, because people came into the system seeking the child tax credit. Have we gotten that to zero? No. Could we do profoundly better? Absolutely. This is the work that I'm doing at the lab of really thinking, as we make our benefits more anchored into the IRS, we need to make the IRS better at doing this kind of non-taxpayer gap.
Yeah, I mean, stepping back, right? Like the IRS was not designed to deliver social welfare benefits. That wasn't the purpose. And so I think there's just been enormous challenges intersected with the fact that they're profoundly underfunded to actually do all of this and do it well. It wasn't their mission in the first place, and then they don't really have the resources. There is some sort of interesting international comparisons, because we're not really alone. Like places like Australia and the UK, for example, are increasingly delivering social welfare benefits through the tax system. And one thing that Australia did that I think is really interesting is actually kind of created an agency within their tax agency. And it gives them just a lot more freedom to think differently, basically, right? Like it's a very different thing to collect money from people than to try to give it to people, to try to enforce rule, and so I think they've had some success in terms of dealing with some of these challenges that the IRS is facing.
And exactly to that point, like CTC is one of those things that, as Tara says, sort of crossed IRS over into thinking about itself a little bit differently. And I think that's something similar for SSA as well, because SSA as like an organization kind of thinks of itself as an enumerating agency, like they give you your number and that's sort of their relationship with most people. But as we've even thought about like paid leave or future kind of more universal programs like that, like who's the right fit to actually deliver a program like that? And are their staff and organizational model going to be ready to support that? Like IRS is still working that out too for CTC.
I mean, I think you wouldn't invent the government we have today. You wouldn't, but it, my co-author Hannah says, like, it's not like you can have an app for old cash that's like an alternative. Most of the companies that we see today that provide public services were not around at the turn of the century in the way the government was. So you have to remake it. You can't shut it down for a quarter and not do Social Security checks or have people pay taxes, and actually rewiring the IT systems, the forms live And kind of in some ways the inability to pilot small. You can't say we're just going to try this with a few. Generally speaking, Amira may disagree. You can't. We're going to try this with a few people and see if it goes well, and then we're going to do it to everyone. You're the federal government. You have to roll out health insurance to everyone on one day. And so I do think there's something to just the nature of, like, Kodak. The companies didn't survive the digital era. The remaking from government is profoundly harder.
Dan, so we had COVID tests, then we had COVID vaccines, and then we had COVID masking from the government, I guess, too. So talk about which of those programs, and those are all run by states and Walgreens and all kinds. So what worked well in the sort of health part of COVID, and what really didn't work well in your view? To ask a really narrow question.
That's a good question. I think probably the success story has been, well, I'll pick two. The most obvious is creating a website where you could enter information in 5 minutes, and then a week later, some COVID test turned up at your door. Like that, for me, that was a model of how government could work, where you reach out for help, government doesn't demand much of you, and it delivers a service. And people recognize that experience as equivalent to the best-in-class private experience they would have, right? I think there was also a moment with the vaccine rollouts where the way in which the benefit of the doubt was given to people who were trying to get vaccines, right? You're trying to get a service, you go to a place, you show them your ID, and they give you that service. In this case, it was a vaccine. And there was a minimal of hassles to get that, right? And that reflects a certain set of assumptions, which is that we want you to get this benefit. We think it benefits not just you, but the entire community to do that. And that's true of a lot of welfare services as well, right? It's not just good for my family to get SNAP, it's also good for my kids, it's also good for my communities. It has these other positive externalities. But often in these other services, we tend to have different sets of assumptions about the barriers we put in front of people. So I think there's a whole list of lessons from the pandemic about things that we did well and we did badly in government, and there was a lot of improvisation. I think the great tragedy will be if we don't take those positive lessons going forward and sort of say, oh, there's a philosophy there if we want to keep this approach for all sorts of services, not just sort of pandemic-related services.
Anybody else want to? Okay, so and then the last question for me at least will be, talk about somebody, I guess Tara and Amira maybe first. Executive orders don't mean much to sort of regular humans, but talk about why this is important that Biden signed an executive order that the government should try to help people. It seems like maybe why didn't it exist before, and what is that going to do?
So this executive order in particular was really exciting to me because I think there were a number of really exciting day one executive orders that we've also been working on, like the advancing racial equity and support for underserved communities. And if you look at it, and that's been a phenomenal effort as well. But just even if you look at the structure of those two executive orders, sometimes a lot of time in the past, customer service executive orders have these one-time actions, like agencies should produce a plan. We'll do a report to the president, like that type of activity. And then if you look at this executive order, it's pretty long and it's not sexy in a lot of parts. And that's because there's a lot of architecting of how do we actually build a system to get to the earlier points made around, this isn't the government that we would have designed perfectly. It would make more sense to think about a mother who just had a child and what are all the services that she needs at that moment, right? Instead of thinking about WIC over here is, the Women, Infant, and Children benefit is funded by USDA, and this other program over here is at HHS, and this other program over here is at Social Security, and so I think we tried to start to construct that in a way that is new and different, and I think it was really exciting that we had this moment where we had a ton of policy officials that understood, like, oh, we actually have to do some internal plumbing work. And so that's why this executive order in particular is very exciting to me. I think it's also really important that we've never before been talking about like centering the government on people and thinking through, you know, how we deliver services through the lens of the moments that they have, and creating accountability for our, you know, secretaries and political leaders around, you know, are people having, like, what are the experience measures for your services? And are you performing well on that? The way that we've had this entire counterweight around program integrity and financial management, which are obviously very important, but that's been the thing that people get hauled up to Congress to testify about, right? People aren't getting hauled up to Congress to talk about, like, you know, are people being able to access your services, right? And so it's trying to create a different kind of incentive structure as well that I think will be helpful as we're trying to keep this a priority for people.
Anybody else want to add anything? You don't have to answer. Anybody else want to add about the executive order?
I mean, as someone who wrote a less effective executive order on making the government work, like this one has the hallmarks of accountability in the way Mira said, and often executive orders can be a feature of White Houses. You know, I worked on one that was about making the government work for communities specifically, but it didn't have the lever that this executive order has in being tied to a set of presidential management goals that have a cadence of agency reporting. And so I think it was really, you know, the push-pull between what you can guide and set a tone for. I mean, it's really important for me in the work I'm doing to hear the president say, you know, we're going to put people at the center. And it may seem like, geez, I think the dean said this, like, isn't that what we do? But sending a command signal like that and having an ownership architecture that is beyond the White House or OMB for that matter into the agencies, that's hitched to things that they have to do, I think is incredibly smart and quite different from versions that have come before.
One of the things I had a mentor say to me once is, like, when you're working on an executive order or a guidance document, erase all the people that exist today and then look at it. And so, you know, the way people could interpret it, the way, you know, what would happen if none of us were here kind of reflection exercise that I think is, you know, often like a longer term view than I think a lot of people in government sometimes take, just because you're like fighting the fire of the day and trying to respond. But being more proactive about, like, if none of these personalities existed, what would the government still do? Because there's a lot that we would still do in financial reporting and, you know, looking at those bureaucratic things that we spit out every day. Like, how do you, like, embed your stuff into that, which was...
I think, you know, just to add to that point, like, these executive orders I sort of read as technical, but they're also statements of values. And putting people at the center of government also becomes a tool to change the culture of government in the long run, where, you know, folks know in these agencies now, every year I have to talk to OMB about what processes we have and who's not getting services and how we're trying to fix that in a way that I didn't have to before. And if you join the workforce and that's the norm, where people talk about that all the time, that's a very different workforce from one where people never talked about that. And in time, hopefully you sort of internalize that. I sometimes like to sort of contrast the experience of cost-benefit analysis for businesses. Like when you want to pass a new regulation on business, you have to write a cost-benefit analysis to say whatever hassles we're putting on business is justified. And there just isn't the equivalent counterweight for regular members of the public. So institutionalizing some processes that force policymakers and bureaucrats to think about those things just seems like an inherently good thing. And it seems like it should be a bipartisan thing as well. It should be something that both parties would intuitively agree with.
And to the point about values, I mean, the other thing that was so amazing about the order was it was very clear up front, like, we want people to have a good experience when they interact with government, right? And it's such a basic and important value, but not one that's really been articulated before, in part because there's a lot more attention to fraud and abuse, and a range of other things. And I think it's really interesting in terms of Don's point and how that filters over into kind of organizational culture. If you look at the development of the Social Security retirement system in the 1930s, they spent enormous amounts of time with the staff at SSA training them to think about members of the public who are going to be accessing these services as deserving, as worthy, as we need to do everything that we can help them. There was just a whole way of thinking that I think filtered out then into a lot of different choices they made about how they designed the program. And so to see that kind of language in that executive order was just really amazing.
We have till 5, right? So we can take some questions from the audience now. Just to give you rules, but I ask your questions. But if you have a comment, I'd like you to just give your comment, and if you have a question, make it a question. And if you're a Georgetown student, I know you're smart, so your question does not have to necessarily demonstrate every book you've read. So, and with that, do we have other mics? Say it again? Mics are on either side, it sounds like. Okay, did I kill the questions? Oh. Do announce books. So, okay, all right.
Hello, okay. This is the first time I've been at a mic in like 3 or 4 years. So thank you so much to the Georgetown Tech Policy Initiative and the McCourt School of Public Policy for putting this together. My name is Julia. I'm at the Beck Center. And you know, thinking about the 20% of people who are eligible for benefits but aren't able to get access to it, I think there's this delicate balance between accounting for the most vulnerable people, you know, the non-filers, and also how do we mitigate fraud or abuse, right? So with the SBA Payment Protection Program, I think they released a notice saying like, hey, if you haven't heard from the IRS about your form 40, 50, 60 in 10 days, just like give the money, you know? But what happened was lots of people, you know, were submitting to the SBA and like getting, like I think ProPublica reported that like billions in dollars of fraud was committed. So like, what are solutions to balance like making sure we reach the most vulnerable populations, the unbanked populations, but at the same time also mitigating fraud? And then one more note, like I'm just like making up a term, but like when these, you know, certain policy changes happen, then there's also like enforcement burden, right? Then now it's the Department of Justice's job to like prosecute like the big $20 million cases of SBA fraud. So that's just a comment, but the main question was how to balance between those two factors.
Take this because I always find this really interesting. The reality kind of is especially for a lot of social welfare programs, the same things that will reduce burden will also actually reduce fraud. Yeah. So if you have good data sharing across agencies, that's a way to reduce, and not even fraud. I think it's important to understand too, a lot of times the programs are just really confusing. So most fraud that we see in social welfare programs is actually people just making mistakes. So I do want to clarify that. But even that level, if you have really good data sharing, it both makes it easier for participants and also reduces the sort of misallocation of spending within those programs. In fact, I'm sorry, I love the Social Security program, so I keep coming back to it. But the origins of the program, the reason why we ended up with this system where we track everybody's earnings is in part because the model that they had considered, which is everyone keeps a little stamp booklet and you collect stamps over your lifetimes of earnings, was because they felt like that would be more subject to fraud, actually. So I don't think these things are necessarily contradictory. I do think it's fair, like the business administration is a particular example where it's complicated. But I did want to sort of step back and make that point.
And I'd add to that. It's not that program integrity is not an inherently important public value. It absolutely is, and members of the public should feel reasonably confident that their tax dollars go where they're supposed to. It's, I think, just a matter of thinking about trade-offs between values and being explicit about those trade-offs. So, you know, if I was to tell you that if you change the rules so that one person attempting to defraud the state would be prevented, but one person who is eligible would also be prevented, how comfortable are you with that trade-off? Or if I was to tell you, you're going to prevent one fraud, but 10 eligible people are now not going to get benefits, how comfortable are you with that trade-off? So these are sort of empirical questions where ultimately policymakers who were elected get to make those decisions. They just need to think about those two choices explicitly when much of the time they're just thinking about preventing the one person from defrauding the state, regardless of the effects on the other people.
Other questions coming up?
Good afternoon. My name is Louisa Scholler. I'm also an MPP student here. My understanding of the executive order is that it also opens up agencies to study and contract with groups that would study the effects of the executive order later down the line. So I wanted to know which groups are going to be doing that. Do you know where should we be looking to that information? How it will be shared out? And similarly, how can, I guess I hesitate to use this broadly, but how can media and journalism help share about the benefits that the order is going to, hopefully produce in the future?
One of the things inside of the executive order around the life experiences piece is like we had a specific call out to prospective plans for evaluation, which is like pretty wonky, but it basically means that, a lot of times in government we run a program and then we're like, oh, we should evaluate it. And then you kind of have to back into what data you've collected or how you've structured or designed it so that you can do some type of program evaluation. And so I think one of the things that in particular will hopefully build into a lot of the life experience work is how do we embed people that have an evaluation mindset or even a qualitative research mindset into the team that's actually reflecting on the process that's happening and how that's working. As far as like specific orgs or groups, I don't think that that's like planned. But I think in particular universities are great partners for. We use the IPA, that's the Interpersonnel Act agreement, which is a great way to bring in folks from universities into actually working on teams. So I don't know if your question was like, are there specific organizations you should be looking at? But I think Georgetown's obviously been part of the conversation to date.
There was a media part of your question.
How do we share?
Speaking for the media, I'm guessing the media covered the executive order for 2 hours that day and then moved on to what Biden had done wrong that day already. So I'm guessing that's not.
It doesn't make a good story.
Well, I mean, I do think there is more coverage about implementation than there was before, and I think that is going to be. I think there's an understanding, Obamacare, the vaccines. I think there are more reporters, there's more reporting around how inflation is going. I think all of that is almost always oriented on the negative, and I think at some point it might be useful. If I was the minister of the media, I might say we should find some programs that work and tell people. I think it'll continually be a problem for government services and probably the Democratic Party if the media says X program never works and never comes back and says, actually, Obamacare's website at some point did work and now people are enrolling. But I don't think that's like that changes anytime likely. I think if Trump had ran some program really well, it would have been so surprising. Hopefully that wasn't something I'm not supposed to say. But if Trump had run a program so well, that would have been so surprising the media would have covered it. Beyond that, it's sort of expected a semi-competent, leader can get people to sign up for programs, which is like not true. These numbers I think is not well known in the media. And I think that's a problem is we don't cover implementation very well.
I do think this is a sort of a real challenge because the subtitle of the executive order is about public trust. And the hope is this will nudge people to feel better about government. And my observations are government is terrible at telling success stories about itself. Like it has a hard time for a variety of reasons, but when they do something really well, explaining that to the public, and then the media covers implementation when it goes wrong. And this is not a criticism necessarily of the media as much as
Go ahead, Dan. I'm not upset.
We click on the stories that we find more interesting, and then the media partly responds to that. But it does seem like a problem with our theory of change here, which is that we want better government, and then we want people to recognize that better government. And so there has to be some way we're conveying that information to them.
Thank you.
Oh, sure. I can't see you. But anyway, yes, go ahead.
But you'll be able to hear me, I promise.
Perfect.
But Perry, you look like you wanted to do a follow-up. Did you? Yeah.
Only to say that I do think the vaccines have actually been covered sort of like, I think they're having stories saying this is a uniquely, very few things in America do 70% of us, is that the right number, do, or what's the, around 60, whatever
You're talking first, second,
whatever
booster.
the vaccine number is. I think the story is like most of the people who are not taking vaccines are non-voters or Republicans, but most Republicans are taking the vaccine. I think it's sort of true, and I think the media is covering the vaccine story and the rollout of that pretty positively compared to other things. I'll stop.
So I'm Judy Fader at McCourt, and I want to commend you all. You tell a very happy story, and we need happy stories. And I think that the success that you're talking about is due to all of your efforts, Pam and Don, in highlighting, and you guys in implementing and putting this into effect. But that's enough happy talk. I want to move on. Because you've talked a lot about the barriers to institutional barriers, institutional inertia, limited resources, culture, and you talked somewhat, I think Pam and Don alluded somewhat to politics as a barrier, and I'm interested in how much you think what you're doing will be institutionalized in terms of change in culture, as Don just emphasized, and how much will be at the mercy of politics, because a fundamental reason that benefit programs don't do what we'd like them to do is because of political opposition, and they focus on fraud because they really don't want government to do well. That's really not the objective. So I'd like to hear your thoughts on how embedded and how culture changing you think what's been accomplished will be.
Start. One of the things that I actually find incredibly interesting in the process of kind of researching burden, writing the book, and all that sort of thing, was the degree to which sometimes, and Judy, you're not going to like this, sometimes it's really not about politics, at least politics in the sense of a barrier. So like if you look at a state like California, for example, California is arguably one of the most progressive states in the country, right? It has one of the lowest take-up rates for food stamps. So it's not that it's not a state that isn't supportive of that program. They've just done a terrible job designing the administrative infrastructure. And a lot of this is this devolution thing again, like there's county level administration of food stamps in California that led to those negative outcomes. So maybe I'm just an eternal optimist. But one of the things I do think of, or one of the things I really appreciate about this shift and attention to this compared to prior administrations and prior years, is that I do think there's actually a lot of spaces that are amenable to making these changes. And I put California as a really good example, and they actually have been doing a lot of work to try to fix it. Or even the rollout of the ACA, like the exchanges, right? Like there were a couple states like Colorado, for example, initially did a really bad job with their exchange, but they wanted to fix it, right? Like, so they didn't do a great job, but the political will was there, and so they did eventually fix it and do it better. So I don't know. I just sort of think there's a lot of room in places. There is a lot of political resistance in a lot of places, but there's also a lot of room in other places.
Let me follow up and add, and Dan's ready to talk, but it seems to me the executive order that I read, President DeSantis or President Pence doesn't have to withdraw that. Am I wrong to think that some of the policies in that, it's not clear they're opposed to the government being good to people, right?
Yeah, it takes an executive order to cancel another executive order, and that's actually like a lot of work. So
I don't think it's a laziness question. I think it might be. Is it possible they agree with it? Is what I'm trying to ask.
And so it's interesting because we actually had a policy official from the previous administration say in an article about this executive order that we had it drafted, the startings of it, in the previous administration. And so what happened was a lot of other things happened at the end of the administration, so it didn't get out the door. And I think it was great that we got to spend more time on it and go a lot bigger in many ways. So I think there's a lot in there when we talk about consumer experiences, being on par with the private sector, like making government more like a business, that I think a lot of this actually really resonates. And one of the things that we were doing a lot of in the last administration was talking about the cost. Churn costs money. Especially when it's like around 20, in some instances it's around 20%. That's a government agency doing a fifth of its workload that it doesn't have to do, right? Because all those people then end up reapplying. And so anything we can do to save money is also, there's some framing that you can do that I think resonates with both sides.
And Daniel, so this will be the last comment. So you will.
Yeah, I'm more optimistic about this executive order surviving. But to Judy's question, I think the last chapter of our book sort of says progressives just do a lousy job of talking about this, because one thing they could do that they haven't been doing is just increase the political salience of administrative burdens, but pointing out to the public, look, these people are screwing you over. They are making government deliberately dysfunctional. That is a powerful message, I think, that progressives don't actually pursue enough. The other reason for optimism is that you can embed within the bureaucracy practices that political officials are not going to observe on a day-to-day basis. And here, the sort of everyday dedication to incremental innovation and experimentation is something that you can routinize in the bureaucracy. And ultimately, if you have political principals who want to make government dysfunctional, they'll find the levers to do so. But there's a lot you can do before you get to that point.
And any final comments? Anybody wants to make one? I think we have 2 minutes, but otherwise we can return those 2 minutes to the audience. Thank you all. This was a great panel. Thank you. I learned a lot.
Thank you.